Hi, good afternoon once again. And we are very excited to come your way this beautiful Saturday afternoon. So sorry for the technical hitches at the beginning. We had a bit of problem with sound. You know how it is with technology, but now it's been fixed and we are ready to continue. So just to make up for the time when you couldn't hear me, I'm just going to go back and do all that bit of introduction again. So as I said, I'm very excited to come to you this Saturday because I have somebody special here with me who is going to help us on we are having a baby series this Saturday. But before I introduce her, I just want us to think about the other sessions that we've had. Has it been helpful to you? Have you been encouraged to go out and have more sex, maybe to make a baby? Have you used some of the tips to be able to, have a baby, get pregnant? What about your minor pregnancy ailments? Have you experienced have you gone through some enjoying the pregnancy experience? Whatever it is, share a comment on We Are Having a Baby community page. Let us know, interact with us. We love to hear from you. And whenever we can, we will answer you back. So, back to today. We are going to, as advertised, we are going to be talking about dental issues in pregnancy. And I'm super excited to have here with me Dr. Michelle Kran Ampedu, who is a dental surgeon here at Nyaho, at our dental department. And she's going to take us through this wonderful topic. Michelle, you are so welcome.
Thank you so much, Dr. Angela. So, as Dr. Angela has said, my name is Dr. Michelle, and yes, I am the dental surgeon here at the Yahoo Dental Clinic. So, we run our clinics usually from 8 to 12, 1 o'clock, from Mondays to Saturdays. We share our contact numbers with you so that you book an appointment with us. We like for all our meetings to be scheduled so that we don't have so many people. We know how it is with the dental appointment and having to wait. No, we are trying to keep everybody in line and no wasting of time anywhere at all. So back to what we were saying today. Basically, we are talking about dental issues in pregnancy. And so, as a way of introduction, to be able to understand what at all dental issues here and there may be, we want to talk about dental hygiene. The WHO describes dental hygiene as the practice or art of keeping one's mouth clean and free from diseases and other problems by regular brushing of the teeth, cleaning between teeth and tongue as well. Now, from this little definition, I'm sure you got the flow about how it's not only about teeth, but in the entire mouth, keeping the entire mouth clean and healthy, right? So, for us to understand better, this is an illustration. This is the full mouth, okay? And we have here the upper teeth and then lower teeth. This is that of an adult patient or an adult. But in kids, you have less teeth, the less number of teeth, and in fact, smaller size of teeth. All right, let's deal with this adult set of teeth, also known as secondary dentition. So we have the teeth and then the gums around them, the teeth lower to the gums around them, and the upper lip, the lower lip, the tongue, and also some other things like the palate, the tonsils, the mucosa, lining the inner part of the cheek, and all of that. Now, let's narrow down to a tooth and see what really happens or what really a tooth is made up of. Now, this is a very good illustration of a tooth. A tooth is mainly made up of two parts. That is the crown, the roots, which are linked together by the neck. We call this part along the gingiva, the neck, this aspect, the neck of the tooth. So from today, we should understand that the tooth is not just what you see in the mouth when it's just like the white pearls in your mouth. I mean, some people would think, oh, my tooth has come out. And it's not necessarily their tooth has fallen out. It is like the upper part, which is the crown today, we know it's called the crown, is broken. And then the whole roots are left in there. So really, your entire tooth is not out, but you have a fractured tooth. So if we understand that the tooth is actually a whole entity which consists of the crown, the roots, and then the neck or the cervical aspect, which makes these two parts. Now let's focus on the crown. It's made up of layers. We have the enamel, the dentine, and then the pulp. The enamel is more like the hardest coating of the tooth to serve as a protective layer. In fact, it's the hardest substance in the entire body, harder than even the bone. Yes. And then we have dentine that falls underneath the enamel, which is a bit softer than the enamel, of course. And then the very vital part of the tooth, where life exists, the nerves and blood vessels exist. Okay. And then we move to the roots. The roots does not have an enamel, but rather a dentine, and then some parts of the pulp that now would continue and join with the rest of the nerves that goes on to form the nervous system into the brain, and then all of that. It's very important to understand this anatomy as we are explaining at this point. It's going to help us when it comes to understanding pathologies that are related to the tooth. And also, the tooth is held or anchored down by some structures. Now, these structures are usually known as the periodontal components. It's made up of, first of all, the bone, which in this, when we're looking at the entire mouth, we had the maxillar bone up and then the mandibular bone down. So we have the bone, and then you move on to the cementum. It's more like a cement, as the word goes. That helps to anchor the tooth into the bone. And then between the cementum and the tooth, you have another space that is occupied by a ligament known as the periodontal ligament. So to speak, between the bone and the tooth, there are about two things or two structures and a little space that anchors the tooth in the bone. Okay. So, having understood this little anatomy about teeth, now let's try and understand what it means to practice good oral hygiene. Now, when it comes to practicing good oral hygiene, of course, the very first thing that comes to mind is teeth brushing. And as most of us may know, brushing in the morning and brushing in the evening. This may be done with a manual toothbrush or electric toothbrush. Now, either one of them is just okay. It's just, I always say, it's not about how hard you brush, but how well you brush. So if you are using a manual toothbrush or an electric toothbrush, you just have to follow the process with your mind, in that you're not just moving the toothbrush up and down. You don't even know where you started and where you are going and where you are ending. But that shouldn't be it. You should be able to know what you are doing, follow up with the cleaning, in that you are cleaning every one of the teeth in the mouth, including the back of the back teeth, the back of the front teeth. Okay, so a model here for us to better understand brushing. So we have front teeth, we have back teeth here. So when you're brushing, you're not only standing in front of the mirror to do this, and for leisurely doing this, and to rinse, spit out, and go about their day and they think they are done. No, please. You are brushing completely and very meticulously. So you are supposed to angulate your toothbrush at about an angle of 45 to the surface of your teeth, like this way. It all has relevance. So you are brushing in a circular, gentle motion. We are not brushing like this, and we are not brushing like this. No, we are brushing in gentle circular motion. Go round, round, this way, round, open up, clean the back. Here, we are going to go around. Gentle, short, circular strokes. Gentle, short, circular strokes. In that, you're not trying to do a wide area at a time. No. You take about 3 teeth you are brushing at a time using this gentle circular short strokes, and you'll be fine. Okay, so you are supposed to brush this way. So let's say you have your cheek covering here. So you don't have access like what I was doing. So your access is basically just this way. Bear in mind. But try. If your toothbrush has a small head like this is what we always look out for. Ideally, your toothbrush should have a small head with flexible bristles, soft, flexible bristles. That way, they are able to bend, okay, and be able to clean the very crevices, the back, the corners, where the stiff or hard toothbrush wouldn't be able to do. Those ones just sit on the teeth, okay. They sit and they are really not clean. And yourself, you realize that when you're using a hard toothbrush, it's painful. So you won't brush even so hard, which is not even right to brush hard. Okay, so you'll be doing some things, just some things, and then you think you are done. No, please. So, as I said, circular, gentle, short strokes, brushing the front of the front teeth, the back of the front teeth, the front of the back teeth, the back of the front teeth, both upper and lower. Don't forget lower, especially this part for the lower, especially in here for the lower, not just here. So that's with the teeth brushing as a very important practice when it comes to keeping a very good oral hygiene. Then we go on to, of course, flossing. It's said that when you do all of this and you don't add flossing, you have skipped about 40% of the teeth surfaces in your mouth, okay? So that's because, especially for people with closely packed teeth, they don't have spaces between their teeth. Even though the flexible toothbrush is able to, of course, like I said, flex and get into crevices, it's not the same as actually using a floss to specifically clean in between the teeth. Not only when you feel there's something stuck in your teeth after eating, but it's an adjunct to your brushing routine. Okay, after using the toothbrush, you floss also every one of the interdental spaces. The catchphrase to everything I'm talking about, you are cleaning your mouth completely. So don't do some and leave some. Now, another adjunct to this whole thing is using mouthwash. Again, mouthwash is only an adjunct to the very primal act of keeping good oral hygiene. That is using the toothbrush. It's an adjunct. It does not in any way replace using the toothbrush, please. So, also, very importantly, after we are done doing all of this, as we described in how one's mouth looks like, you have the tongue in your mouth. The tongue is also one very muscular organ in the mouth that can harbor a lot of bacteria actually. You see, it has these taste buds that point out like that of the towel fibers and creates more like a conducive housing for bacteria to harbor in. So please, if you do brush your teeth all around and around and you forgo cleaning the tongue, we have done a very incomplete job. And we want to do a complete job when it comes to keeping a good oral hygiene. So usually you find tongue cleaners behind these recent toothbrushes. So I don't know if it's possible to see. Yes, you see this roughness over here. That is for tongue cleaning. Okay. However, some people have some people have really bad gag reflex. So much such that when they attempt to use the back of the toothbrush to clean the tongue, they end up irritating the palate, which is up here. And that's what causes you hear a lot of people in the bathroom going and all of that. That's because of the very bad gag reflex some people have. So to prevent that, there are newer tongue cleaners on the market. That one is flatter. Looks almost like just this, without bristles anywhere. So it's like just this part is the roughness here, and then you have a little roughness, and then it sits just gently on your tongue and will clean your tongue without irritating your palate. Okay, so no more excuses for people with bad reflex that they cannot clean their tongue because of the bristles irritating the palate. And of course, regular visits to the dentist, another very important step to take in the direction of keeping good oral hygiene. You want to visit your dentist regularly, not as and when or when you realize there is pain. Don't be too Ghanaian. I always tell my friends, I'll tell you, come for dental cleaning. They'll be like, oh, but there's nothing wrong with them. I'm saying, you are being a Ghanaian about this. Visit the dentist regularly, and this is 6 months. Every 6 months, you should visit your dentist. At the dentist, there are various procedures that could take place. Not always extraction, as people may think. Oh, to the dentist, I'm going to take out my tooth. No. When you come, there are preventive treatment procedures that we can undertake for you, which includes the cleaning or the professional cleaning known as the scaling and polishing. Okay, and also we have so to speak restorative treatment procedures where we are going to fill a cavity if one has developed. We have also emergency procedures to more like halt the progression of one disease or the other. Very important. And funny enough, most dental diseases begin asymptomatically. Most of them, at the very early stage, is asymptomatic. So, and that's the time, of course, we could go through less invasive procedures to treat them, and you're going to spend less money. So it's not as if the rich people are the ones who go to a dentist just because they can afford, and that's it for the rich. No. When you are visiting the dentist regularly, you're actually saving money. But like I said, you're actually going to end up doing preventive stuff. Even if there's something we are now treating, we are catching it at the early stage, and so you are doing less invasive procedures, you are paying less, spending less time at the dentist and all. I mean, at the end of the day, your socio-economic is going to pick up. And also, another practice that's very important is to keep a very balanced diet. Eat healthily. There are some foods we call mouth healthy foods. These are basically the fruits and the veggies, or the whole grain kind of food, not the processed, over-processed foods like refined sugars here and there. Those are not mouth healthy. The mouth healthy ones are the fruits, the veggies, the whole grain, and so it's we encourage like snack on those rather than snacking on the less mouth healthy diets. Another very important step to keeping a very good oral hygiene is to like I said, have a very healthy alternate snacks, which is a healthier snacks, which is the fruits and veggies, rather than the Snickers bar here and there and a bar of chocolate here and there. Now, let's move to the importance. Okay, we know how to keep a very good oral hygiene. How relevant is this to the individual? I may have spoken about some along the way, but another one very important reason is that it reduces your chance of getting to a more severe stage of diseases in the mouth, of course, and so reduces the chance of getting bigger infections and helps you maintain the integrity of your teeth and gums. And mind you, this example I gave of an adult set of tooth are supposed to last you your entire lifetime. Okay, when you lose one tooth as an adult, you are not going to have it replaced naturally. If you want a replacement, we are talking about more money now. Okay, some people do have this mindset about how when they hear dental, hey, everything about dental is expensive. It really isn't. It really isn't. It really isn't. Just be regular at your dentist, and we can help you cut down costs, unforeseen expenses here and there. Please, please, please. We are very friendly dentists actually. The kids love us. Come with them also. Okay, so let's talk about some very common diseases. Okay, and eventually we'll be talking about how common we find these diseases in the pregnant lady as well as the average individual. So the very important one that we all know about is caries. That's like the very common one. However, it's not the only one, but I like to start with that because it is the most common. It has to do with the tooth by itself. In that, it's a disease. Sorry, it's a disease that's affecting the hard tissue in the mouth, which is the tooth in this case. Okay, so caries can either be affecting the crown or the roots. Interesting. The root that's in the bone can also get caries. They can get root caries. You can get crown caries. Also, we have caries at the early stage, known as the incipient caries, the ones that get hot in the process of the disease. That's the arrested caries. And then we have undermined caries. There are so many types, and then depending on the location the caries occurs, you can have some in the fishes, okay? In the fishes, that's the grooves you see in the teeth, or the smooth parts of the tooth can also get caries. Don't get it mistaken. The smooth part of the teeth can also have caries. You can have baby bottle caries in kids, which is very common also. And then move on to another very common disease, that's gingivitis. Gingivitis is a disease that usually affects the gums. Gingiva is the gum, so it's an inflammation of the gum. Now, the good news about gingivitis is it's very, very reversible. Okay, but like most diseases, when it comes to dental issues, as mentioned earlier, are not painful. So if you're going to wait until it's painful before you come, you may have gone past the very, very reversible point. Okay. So aside from the fact that it's painless, one other symptom about this is bleeding gums. If you brush your teeth and you are seeing blood in your spit after brushing, that's a very, 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 very it's a good sign that you're having gingivitis. Also, if the gums are red by themselves when you look in the mirror, or they are swollen, that is another sign of gingivitis. Now, if gingivitis is not curbed, it can easily progress to the more dangerous and irreversible gum disease known as periodontitis. So with periodontitis, now the periodontal structures we talked about earlier, remember we're talking about the bone and the structures that help anchor the teeth in the bone. That was the cementum and the epidial. So now those structures are compromised such that eventually the teeth begins to give. You find out that the teeth are dangling in the mouth, and then you lose one tooth, the next one just falls out and again, and it's happening. Another disease of the mouth that's also very important, especially in kids, is fracture. Okay, lots of people walk around with fractured front teeth, and they think it doesn't hurt, so it's not painful. No, it's a disease. As far as it's something away from the normal, it's a disease. And yes, when you come, a lot can actually be done that you may not have known about. A lot can be done to help rehabilitate your smile, which of course eventually affects how you socially interact and your self-esteem as an individual. Also, another very common pathology we know about is halitosis, which is caused by dry mouth, stress. Pregnancy is a form of stress. Now, let's veer on directly about pregnancy and how it relates to dental issues. Okay, pregnancy by itself causes or say subjects the body to stress. Okay, and so you are prone to basically a whole lot of infections. Gingivitis being a very paramount one of them. Okay, so when you are pregnant, it's very important that you visit your dentist, and when you do visit your dentist, kindly let the dentist know freely just mention, oh, I am pregnant, or I think I am pregnant, or I'm trying to get pregnant. It's very important to let us know, because it helps us in terms of deciding which kind of treatment modalities may be appropriate for you, or may be suspended because of your situation. A lot, please. So do not hide it from the dentist. The dentist is your friend, like I said at the beginning. Let us know if perhaps you have any other comorbids, be it hypertension, diabetes, as an individual. When you visit the dentist, kindly let the dentist know. Especially also for the fact that you may have to take an x-ray when you visit the dentist, which is like a common knowledge, right? Most of the times when you come and see the dentist, when we look in your mouth, you're only seeing the pearly white crown part of the teeth. Mind you, the tooth also has the roots as part, and we do not see that when we look in your mouth. So we may want to take an x-ray. Now, when you're pregnant, you cannot take x-rays. And if a mistake is made and someone is not informed and x-rays is done on a pregnant lady, even though at our facility here, as a routine, we always give our patients a lead protection apron, every patient, male, female, routinely, which is going to help if perhaps you mistakenly did not tell your dentist or even did not know that you were pregnant. It saves you that way. So please don't be scared. I'm trying to alleviate all forms of fears that may keep our people away from visiting us. Kindly come. We are still protected. But if you are aware that you're pregnant, just let the dentist know so that we do not at all try to take x-rays. Also, with a pregnant lady, it's also really important that you visit the dentist not only once, but as often as you could, because one thing is when one is pregnant, the hormone progesterone is the type the hormone progesterone basically increases the chance of plaque accumulation on your teeth. Okay, so you are going to have the higher plaque accumulation than the regular individual. Okay, so if you perhaps you used to attend the dental clinic once a year, when you realize you are pregnant, it will be very, very prudent to be doing this at least every 6 months. Now it should be regular for the pregnancy, very, very regular. And if you can make it every 3 months, the better. Okay, because now when one is pregnant, this person is prone to more diseases, way more diseases than even the average person. So you could easily progress from the gingivitis I talked about to periodontitis so easily as a pregnant lady. Okay, so we absolutely do not want that, and so we do not want the usual gingivitis that could have been reversed so quickly with the simple scaling and polishing, that is cleaning, now leading to periodontitis, where the entire structures that anchor the teeth are giving way for the teeth to fall out. So kindly do visit the dentist. Also bear in mind, whilst you are bearing your child in your womb, at the time, as you may all know, organs are forming, including your teeth. Including the baby's teeth are forming. Okay, so the baby's baby teeth, the baby's adult teeth, some of the baby's adult teeth have already begun forming while the baby is in your womb. Okay, so you have to be very careful so as to stay away from some particular drugs like tetracycline and ciprofloxacin, because those ones have been known to be able to penetrate into bone and teeth, mainly because of their calcium components. And you don't want your baby eventually later on in life now having to live with stained teeth just because you took one drug or the other while they were pregnant. And mind you, if you needed to take that drug for some reason, there's always an alternative. So it's important to let the dentist know, the OBGYN know all of that, and even the pharmacist when you're going to get some people's pregnancy are not obvious. Please, that's why it's important to let your healthcare provider at every sector, as much as possible, know. Okay, so we'll end it here. And any questions?
Wow, thank you very, very much, Michelle. That was so educative. I was engrossed, captivated with everything that you were talking about. Thank you. So, just one takeaway that I got from this OBGYN, pardon me. Gentle, short, circular strokes.
Yes.
Is good for everything.
Yes.
Everything. Gentle, short, circular strokes for your teeth.
Yes.
It's good for your teeth.
That's right.
Don't let your mind go anywhere else. We are talking about teeth today. So just to set a few things clear.
Yeah.
So you said it's safe to go to the dentist when you're pregnant, right? I know at the dentist they mostly give local anesthetics.
Yes.
Is that also safe for the pregnant woman to take?
Yes, please. So very safe. As the word goes, local anesthesia. So hardly is it going to affect the baby that's going systematic and then eventually through the blood vessels and then getting to the baby. No, please no. It's locally acting. And it fades away in a matter of 2 to 3 hours.
Yeah. So being pregnant shouldn't stop you from getting procedures done. Because like you said, your teeth is there for life. When you lose it, you are going to spend money to put in new ones. So if you have an issue that needs to be solved, being pregnant shouldn't be a barrier. The most important thing, let your dentist know you are pregnant. And in fact, not only your dentist, every healthcare worker you meet during your pregnancy journey is important. I always tell my clients, my patients, 2 people you shouldn't lie to on earth, of course. You shouldn't lie to God. But 2 people you shouldn't lie to, your dentist and your your doctor and your lawyer. Exactly. Because the lawyer is going to get you out of trouble. Even if you kill somebody, you should let your lawyer know. And for your doctor, if you don't let them know what's really going on with you, how are they going to be able to help you? So I wanted to ask you about vomiting and the teeth. You know, for pregnant women, vomiting is like a thing. We do it. So you don't want after you vomit, then your mouth is feeling and you quickly want to go and sort of brush it. And so what should we do?
Yes. So very important. Thank you for bringing that up. Yes, you pregnant women are known to vomit a lot, but please do not brush right after vomiting. Rinse out. This is because the content that has pushed up into your mouth contains acid. This is eroding the surface of your teeth, the enamel. Now, at that point where it has had contact with your tooth, it's causing erosion. Dilute that acid with some water, rinse. Now, when it's diluted enough, you can go in and then use your toothpaste and mint in the toothpaste to make you feel good and all of that. Sometimes you can even decide not to actually brush, just use a tongue scraper alone because then you feel your mouth is better from the vomit. Okay.
Great, thank you. Then I also read that there are pregnancy tumors in the mouth that's kind of like come up when you are pregnant, and some people experience it, some people don't. Can you shed a little bit of light on that?
I have heard that many times, and I ask around. And from my little research and what I have found out, there's not like a pregnancy tumor in the mouth. See, I don't know, I'm not an OBGYN, she's best at it.
I haven't seen any.
Okay. So how do you have a pregnancy tumor in your mouth? Like, how do you have a connection between the womb and your throat or your mouth at labor? No, it's just that during labor, you see a lot of things are happening. Hormones are spiking, things are changing, all of that. So just like your morning sickness that causes you to throw up. And mind you, the stomach content is warm. The acid in your mouth is warm. So it's not like it feels warm like the amniotic fluid. It's not pregnancy tumor, that's liver.
Thank you. So just to remind everybody, both Michelle and I are fully vaccinated for COVID-19. We are sitting the required 1 meter apart. So just to be able to see Michelle's smile, for her to see my smile, that's why we don't have our mask on. But we are both fully vaccinated. So I have a couple of some comments from our guests online. So Sarah says, can I whiten my teeth whilst pregnant?
Thank you. Oh, that's why I like the question session, because I feel like it brings on board a lot of things that for some reason I may have forgotten of course of time. Okay. Yes, when you're pregnant, like I've been keeping up with your series. Something like to slay and all of that.
Yes, it's very important.
Let's just hold on with that. Let's just go through the journey. When we are done, we'll slay better with the teeth whitening.
So purely cosmetic procedures we should hold on to, and then do the ones that are necessary during pregnancy. Great, I get you. And then Frida wants to know, is it normal to experience, I think we talked about this, gum bleeding of the gums. I think the question came before. Because she said whenever she's pregnant, her gums bleed.
So please, you have to be extra regular. 3 months should be it for your visit intervals.
Okay. And Margaret wants to know, is it true that some pregnant women lose their teeth when they are pregnant?
Okay, so I actually spoke about that, about periodontitis. That is the disease that causes one's anchor system to give. Because gingivitis have been left alone and it may have progressed to the more irreversible and dangerous stage of periodontitis, which is common in the pregnant woman. That's why you have the myth going around that, with every pregnancy you lose one tooth. I mean, no. But if you are really taking good care of your teeth, you are not going to lose even a tooth. Okay? You are not going, it is not automatic or a must that with every pregnancy you should lose one, you should lose a tooth. No, please. It's with bad hygiene practice that will lead you to losing
Otherwise, something you don't need to lose your teeth. No. It's not like a crown that you have to wear. It's not like a battle medal that you have to carry. It's only a sign that you have not been keeping good hygiene, dental hygiene. Vic is very happy and she thanks you so much.
Oh, my pleasure.
Asking for blessing. Sheila wants to know, will acid from morning sickness or acid reflux harm her teeth?
Yes, please. I have already answered this. I'm going to do it again. Yes, it's going to harm your teeth. It's acid and it corrodes or erodes teeth surface, enamel, and especially this part of the teeth. Okay, there's inner parts. Because some people, the vomit would actually come into their mouth before they find somewhere to throw it. The contact. So immediately you throw it out, just rinse so that you don't have the same concentration having contact with the tooth for too long. Duration is important.
Yeah, something I wanted to mention. So the thing about periodontal disease, a severe dental disease, and pregnancy is that it's very likely to cause miscarriages, which is really, apart from all the tooth issues, maybe losing your teeth and having bad ache because of toothache. The problem we worry about as obstetricians is that you are going to have preterm delivery and then being in Ghana eventually might not end up so well for the baby. So please do visit the dentist. Make it a point at least once in your pregnancy journey to visit the dentist. Of course, Michelle said we need to do it twice a year, so every 6 months we need to go. I'm making a plan to book my appointment to come and see you guys very, very soon. I think it's been a bit more than 6 months. So I'll be there. I've been naughty, so I'll be there soon. So Ruth wants to know, is it safe to get, I think Michelle talked about the x-rays and that is safe. That here at Nyaho, we use the lead apron to cover up everybody. Because some people may be pregnant and may not even know that they are pregnant. So just as a precautionary measure, we do that. And Princess, very educative session. Thank you. Thank you so much, Michelle. So thank you all to our beautiful, loyal community members on we are having a baby page. It's been amazing having Michelle here to talk about our dental issues. I've learned so much, things that I never thought of. I never knew. I've learned so much, and I hope you've also learned so much and you are taking away a bit. Have you invited your friend onto the Facebook page? Have you invited your sister onto the Facebook page? Do you have a colleague in the office who is pregnant or who wants to get pregnant and is yet to come on? Do invite everybody to come onto the Facebook page. We are having a baby, it's a big community, and we enjoy having you, we enjoy interacting with you. There are questions that you can ask there that you may feel too shy to ask in the consulting room, or you may never, you are in the consulting room, this question is Ben. Pregnancy comes with forgetfulness. So it's till you get home that you remember that, oh, I forgot to ask my doctor this question. So put it on our Facebook page. We are always there to answer you. Shout out to all our pharmacists. Today is World Pharmacist Day. You guys are awesome. Thank you for going this journey with us. So if you haven't logged on yet, this video will be on all our social media handles, on Facebook, on Twitter, on Instagram. Please go ask your friends to also come in. Go and watch it again. Maybe you missed the point, maybe at the point when we're having it, so that as many people as possible can benefit from Dr. Michelle's awesome presentation. Thank you once again very much. We are looking forward to having you next time, maybe to talk about the babies and the teeth issues that we have with babies. So we will schedule another appointment. It's been great having you. Thank you so much.
You're welcome.